Welcome to today's episode of Talking Tinnitus, presented by Lanier. We're here with a very special guest, Dr. Melissa Wikoff, joining the show again. Melissa is a certified audiologist. She's a member of the Academy of Doctors of Audiology and a fellow member of the American Academy of Audiology. She's also a previous board member of the American Tinnitus Association and the owner of Peachtree Hearing in Atlanta, Georgia. So welcome back to the show, Melissa.
Good morning. Thank you so much for having me.
Good. It's great to have you. So today's topic is why does my tinnitus sound different to other people's tinnitus, right? And I think that's probably a question a lot of people who experience tinnitus might ask, especially if they're talking to other people with the condition.
Absolutely. And that's such a great question, right? Why is my tinnitus different? Why does my tinnitus bother me differently than his tinnitus bothers him? And what's going on in your brain and your body is so unique to anyone else out there. A buzzing, a clicking, a humming, a beeping, a chirping, anything that you hear that someone else doesn't hear is tinnitus. So do you have normal hearing? Do you have some hearing loss? Are you under a large amount of stress? Are you well hydrated? Are you, deprived of any nutrients? I think we look at this at a holistic approach of what's going on in your body,
Yep.
but your case is going to be different than anyone else's case out there. So the way this bothers you is going to be different than anyone else. And yours might bother you when you're laying in bed at night. Theirs might bother them when they're trying to read a book or concentrate at work. We're all just unique, different people. So I don't think any two people, at least that walk in my door, are going to hear things the same or get the same treatment, right? Just like your sound is unique, your treatment and our approach to this will be different for anyone that walks in the door.
Sure. So I don't think people should be, tinnitus is an alarming condition, but I don't think people should be overly alarmed. Say if they are saying, I'm experiencing a hissing, and someone else that they're talking to is saying, well, I experience it as clicking or whooshing or ringing is a relatively common one.
Typically your hiss and someone else's ring, it doesn't matter. Whatever the cause, it's going to be very rare. There are times when it's life-threatening and you'll see your medical professional and they will know. But if it is not life-threatening, there's no need to be concerned over why yours is a popping or a clicking versus theirs is a hissing or a whooshing. We're going to take care of you no matter what.
And so exactly, find a tinnitus expert.
Yeah.
You'll come in and you'll be assessed. They'll talk through, how your tinnitus is presenting, how it's impacting you. And the treatment, it might be the same as the person who has a clicking or a whooshing and you have a ringing, or it might be different, but that'll be the judgment of the expert and they'll be able to help you with that.
Exactly. It will be the expert and then you as the patient, it's your body. So it's going to be a real collaboration between you.
Yeah, of course. And so I think, we've done a few kind of episodes of this so far with different experts. And one of the kind of common themes that comes up is really that, this is a pretty unique journey and experience for individual patients. And so if it's presenting as a slightly different sound for you, it was always probably going to present as a slightly different sound for you. So maybe don't worry too much about it, but do get in touch with a certified tinnitus expert who can help you out. Super. Okay. Well, thanks for joining the show, Melissa. People's tinnitus does sound different and, get some help and get you on the right path.
Absolutely. Thank you so much.
Thanks.